34-year-old mother named Jennifer Cahill and her newborn daughter Agnes Lilly both lost their lives after Mrs. Cahill opted for a home birth against medical advice.
Did you have a home birth to an 11-pound baby?
I had 2 home births, yes. And Nova was almost 10 pounds. And then Ozzy was 11 pounds. And it wasn't great, okay, because I couldn't get him out. Yeah, it was not, I don't recommend that. Ozzy was big, and he came out hypoxic. He was not breathing. He had the cord wrapped around his neck, but with Ozzy being that large and me unable to get him out at home, he came out and he was not with us. And we could not give him that kickstart. We tried to give him life-saving breaths. He was still attached to me by the cord, so he was still getting oxygen. So we tried everything and then called the paramedics. Eventually, the paramedics came, 5 minutes, cut the cord, took him, brought him in the ambulance, but he was not with us when he left me, so I didn't know what
my God, I'm so sorry.
Yeah, what his
stayed
journey was going to be. I had to stay because I had to get the placenta out. My ex sent me a video of him breathing with a,
oh my gosh,
over his mouth, little breaths in the ambulance. And then I fainted. I passed out.
Right.
I fainted. Went to the hospital and he was in NICU, intubated on a cold bed, induced coma for 72 hours.
So I had a planned home birth that was unsuccessful. So trigger warning, if you are pregnant and you're planning a home birth, you probably don't want to watch this video. I'm going to be completely honest with you guys. I never really did the proper research when I decided to do a home birth. I didn't really realize that what they do at home is significantly different than what they would do in a hospital, obviously. I thought that since I was, low risk, I didn't have any pregnancy complications. I had a great pregnancy. I love being pregnant. I never thought that I would have an issue, but here we are. So when you have a home birth, in my case, the midwives check the baby's heart rate with a Doppler. So they're only really checking for maybe a few minutes at a time. They try to do it during contractions. They try to do it as often as they possibly can, but you're not really getting a strict timeline of how the heart rate is doing as you would in a hospital setting with an NST scan and things like that. So in the hospital, if you're in labor, they can really tell when the baby's heart rate is really dropping. And although I kind of knew that, I just thought, I'm low risk. I have no complications. Things are going to be fine for me. Not the case. I went into labor. I went into labor naturally. Things were fine. I was dealing with my contractions. I was 4 centimeters dilated. I was progressing. Things were going good until they weren't. My midwife checked the heartbeat. Initially, things were fine, but then again, you're only getting the heartbeat for a few minutes. So it's things can happen. She checked the heartbeat again and couldn't find the heartbeat. We were convinced that there was something wrong with the Doppler. It was staticky. Pretty stressful. We decided to go to the hospital, get an NST scan. Hopefully everything was fine, and we would just go back home and finish the home birth. We got to the hospital and there was no heartbeat. So that really sucked, and that's kind of why I'm here today and why I'm sharing my story. I don't want to scare anyone. I know that a lot of people have beautiful home births, and I'm so happy that that is the case. It's just not the case for everyone. It certainly was not the case for me, so I'm allowed to say my story because I didn't have a good outcome.
Part 3 of my failed home birth that ultimately led to the loss of my daughter. So her head had come out at some point. Nobody really said anything to me. I don't remember somebody saying out loud her head was fully delivered or anything like that. It was really quiet. People were just counting while I was pushing, to be honest. Nobody was really saying much. And then all of a sudden I felt my contractions completely stop, and I thought that was a little weird because I had no breaks the entire time I was in labor, so I was a little thrown off by it, and I did yell that out for everybody. The midwife told me that I needed to push, and so I told her I was not having a contraction. I couldn't feel anything, and she was like, you just need to push anyways. And so I was pushing a little bit and nothing was happening still, and then all of a sudden I started to hear the voices of my family members, and I had asked that they be brought into the room when it was actually time to deliver the baby. So my doula had brought them in, and I had no idea. Everybody was so quiet, so I didn't know anyone was in there until they were all encouraging me to push as well. And again, I was still trying to push, but I didn't have any contractions, so it wasn't doing much. And then all of a sudden, I remember my husband's tone of voice changing a ton, and I could tell he was crying when he was telling me to push. And that's when the midwife started saying, "You really need to push, you need to get your baby out now." And I remember pushing as hard as I could. I couldn't do much with no contractions. And honestly, like, before I knew it, this whole part is a blur, but she had told me to flip over onto my back. They pushed my legs up. They were telling me to push. I still had no contractions. She told me I needed an episiotomy. I had not torn at all at that point, and her head was fully delivered. I was super scared for the episiotomy. I remember crying when she said that. And obviously I said yes, whatever needed to be done. And so she did that, and I could feel her put both of her hands inside, and she was trying to pull Everly out, and she was unsuccessful. So she had me flip back over onto all fours and push again, and I was kind of just flipping back and forth. Nothing was happening. I still didn't have any contractions, and then eventually firefighters and EMS were in my bedroom.
A mom plans the birth of her dreams. Quiet room, no rush, no strangers in scrubs, just her partner, and a midwife she trusts. Then something goes wrong, and there's no operating room down the hall. No emergency team on standby, just a phone call and a clock that's running out. This isn't one story. It's happening over and over right now, and it keeps making headlines. Just last year, a case out of Greater Manchester, England, made news when a mother and her newborn daughter both got unalived after a home birth that doctors had specifically warned about due to risk factors from her first pregnancy. But it's part of a much bigger pattern you're about to hear directly from the people living it. Home birth isn't rare. And it isn't new. People have been doing it for as long as humans have existed. For most of history, it was the only option there was. But modern home birth is a different thing entirely. It's a choice made inside a modern medical system, a system that can do incredibly, almost unbelievable things if you're standing inside a hospital when an emergency hits, and can do very little to help you if you're not. That gap between what medicine can do and what's actually available in your living room is where every one of today's stories lives. So today, we're not just reacting to one story, we are reacting to a whole range of real voices. Moms who had home births that turned into their worst nightmare with almost no warning. Doctors who spend their career picking up the pieces when things go wrong and who carry those memories with them. People who survived something terrifying, people who didn't get to. Some of these stories end in loss, a baby who didn't make it home, a mother who didn't either. Others end in fear, but survival, a frantic ambulance ride, an emergency room full of strangers moving fast, weeks in a NICU that change a family forever. That range is the whole point of this video. This isn't a story where one side is clearly right and the other is clearly wrong. It's a story about risk, trust, preparation, and how much people really understand about what they're choosing before they choose it. Because here's something that might surprise you. Several of the people you're about to hear from didn't think of themselves as taking a big risk at all. They thought of themselves as low risk, healthy, well prepared, and some of them still ended up in the back of an ambulance. So here's what we're going to do. First, you'll hear the voices, real people, real experiences, no interruptions, no commentary breaking in. Then at the end, we're going to slow down and actually break apart what these stories have in common, what moms keep saying over and over, regardless of how their story ended, what doctors keep saying from the other side of the delivery room, and where those two groups actually agree, even in moments where it looks like they're arguing past each other. Because here's a preview. Almost everyone in this video agrees on one specific thing by the end of their story, and it's probably not the thing you'd expect going in. So let's get into it. Let's watch a few more clips and then I'll be back with more commentary.
3 days before Lorena was due, my waters broke, but I was set up to a home birth, which I'd already done the year before perfectly with my first daughter, LaRose. Yeah. And contractions just wasn't starting. And I stayed at home because it was the best place I was advised to stay. And unfortunately, when I did finally go into labour, oxygen levels had lost, and I got rushed in an ambulance turned up at the hospital. They wasn't expecting me because it was the nearest one. And unfortunately, she just died due to oxygen loss.
What went through your mind at that point, like when you realised that there was something really wrong and when you made that decision to go to the hospital? What went through your mind at that point?
It is literally like a blur because everything happened quite calm at the beginning. And then it was the panic, the unsure, because the midwife, who was my midwife the year before, couldn't find a heartbeat. So that obviously was a panic. But I was now in full contractions with nothing, drug-free, very, very painful. We didn't really have much gas and air, and I was just rushed in the ambulance, and then I actually was given labour just before I went into the hospital. It happened within 2 hours.
Gosh, Lauren.
It was the worst thing I've ever been through, and I'm still not over it. It's completely changed me as a person. I'm still healing. I'm still getting my confidence back, and loads of things in my personal life have changed. Little things like I go to bed really early, I don't drink alcohol, I really find it hard to socialise. I'm coming out of that now, but there was a lot of things like, even today's the first day that I've got in a taxi on my own, because I can't, I just have this severe anxiety. Going on holidays, which I've just managed to do last year for the first time. It's little things that people enjoy in life that I struggled with. Little day-to-day normal stuff, you know, like I remember going for dinner for the first time probably a year after, and I had to rush home to get back to 7 p.m. Little things like that. I know it sounds funny, it doesn't make sense, but it just changed me, and I'm never going to get over it, but I've just learned to live with it and have to accept what happened. But she's always in my heart and with me.
I had a failed home birth for my first baby. This time, as I'm preparing to give birth again, I'm just kind of reflecting on that experience. I didn't pack a hospital bag. This was because I took a bunch of birth classes that were like manifest your dream birth, like pray over it, write out in detail what you want, like basically like the energy that you put towards birth is what you're gonna get out of it. I just feel like that actually ended up kind of like biting me in the butt when things did go south, because the transfer was so like extra chaotic, because I literally didn't have anything prepared. Running around the house while I'm like 24 hours deep in labor and like 5 hours deep in pushing, and like everything is horrible. Grabbing some like bare necessities that I would need, like literally my ID. We didn't actually end up having, which also ended up being a huge problem. 2, I didn't have the car seat installed, which also was like just like a mental thing to run through. I was like, how are we gonna get this baby home from the hospital? The next one is not having like a birth plan printed out and like what my preferences would be, and I wish my husband would have had that. Financially preparing for the cost of a transfer. We have a super high deductible because we pay for everything out of pocket because we're small business owners, and I wish I would have planned for like the $15,000 we were gonna have to pay. I wish I would have like had that exact numbers like planned out and what it was gonna cost monthly to pay it off, and like blah 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 blah. Thought about that as we were transferring, like, oh my gosh, this is gonna be such a high cost, and I'm like, if I had planned ahead, it wouldn't have been this like stressful in the moment situation.
I delivered my 11-pound, 6-ounce shoulder dystocia baby at home. This is your trigger warning. Obviously, this is not recommended. I was in a severely abusive marriage and forced to have 3 of my 5 kids at home without any medical care or intervention. So delivery began in a tub. Once baby's head was out, I knew something was horribly wrong. In a normal delivery, baby's head comes out and has a little bit of wiggle room. In a shoulder dystocia, where the shoulder is stuck on the pubic bone, the baby's head comes out and immediately retracts against the perineum. It doesn't allow any movement of the baby's head, and it looks like a turtle. It's very squished. This is an absolute obstetric emergency. I knew what was happening, so I immediately got out of the tub and went to hands and knees position on the floor. I had one more contraction like this on hands and knees, and I felt baby wiggling in the birth canal with no downward movement. We were stuck. In a proper birth setting, you would have a team of doctors and nurses. They would put you in a knee to chest position and put pressure on the baby's shoulder, which would be right above your pubic bone. I did not have such care. I relied on knowledge that I obtained from studying for possible twin births.
Okay, so we really need to talk about this because this is really grinding my gears. I was actually literally the most perfect candidate for a home birth. perfect candidate. I did all of the testing. I did the gestational diabetes test. I got the anatomy scan. I actually did another anatomy scan 4 weeks later. So I got one at 20 weeks and at 24 weeks. And I had like really low movements my entire pregnancy. I never really had a lot of movements, like here and there. Like I'd maybe feel my baby like once or twice a day, honestly. And every time I brought that up to all of my midwives, all of my doctors, they literally said it was because I had an interior placenta and that I wasn't really going to feel her that often. Also, she was really only breech around like 30 weeks, and then she did flip. Like, we didn't do an ECV, we didn't do any type of manual flipping. She did just flip, and then she was in the correct position. So technically, that is normal. Like, that does happen in normal pregnancies. But literally, I was the perfect candidate. My blood pressure was never high. I passed my gestational diabetes test. I did all of the testing. I did genetic testing, all of the things. So that's just... yeah, I was a perfect candidate. Sometimes it just does not work out that way. Birth is just, you cannot plan for it.
Listen to your doctors. This beautiful couple didn't listen to the doctors. Now the mother is gone and the baby's gone as well. When Jennifer Cahill had her first child, Rudy, it didn't go well. She had postpartum hemorrhaging. So after the baby came out, she just kept bleeding. She also had group B strep, a nasty infection that could have ended her life and the baby's life, the first child. Despite that, she said she didn't like the way the hospital managed when Rudy, first child, was born. Second child, we don't want to give birth in the hospital. It was nasty. The doctors explained group B strep means you are high risk. Postpartum hemorrhaging means you are high risk. Once you're high risk, you're high risk. Don't be giving birth at home. The hospital is the right place for you. They didn't listen and gave birth at home. What happened next was a series of predictable but tragic events.
Another woman has tragically died after a home birth, and we need to talk about it. Whenever I see stuff like this, my first reaction has always been, why would anybody take a chance? And that reaction comes from my own experiences, my own bias, if you like, because over the years I've been involved in the resuscitation of pregnant women in the emergency department. Some successful, some not. All of them equally as traumatic, and when I close my eyes, I can still remember the faces. Those things never leave you. And so my gut reaction when I see something like that is, why would you take a chance? Here's the thing, people are still doing it, so you have to explore the why. It's coming out and saying, oh, this is terrible, you should just give birth in hospital. It's not working. People are still doing it, so we have to change tactics. As healthcare professionals, we have to do better. So let's go back to the why again. The why is some women have had a really traumatic experience in a previous pregnancy, something that gives a negative connotation to giving birth in hospital. I think we need to explore what that is, because I don't really understand what traumatic means. Does it mean traumatic in the sense of the delivery? Traumatic in the sense of the medications that were used? Traumatic in that they felt pressurised or unheard by the healthcare workers? Or traumatised by the lack of control? I think we need to explore this. But there is this misconception that childbirth is easy, and that women have been doing it for thousands and hundreds of thousands of years or whatever. How hard can it be? But nature does not guarantee safety. In medicine, it's all about risk. And absolutely, women die in hospital while giving birth and after birth. But that's because high-risk pregnancies have to deliver in hospitals. So higher risks obviously going to mean higher complications. Home births, on the other hand, are going to be for the low-risk births. So obviously complication rates should be low, but when something does go wrong, it's catastrophic. I think where we need to be at as a medical community is looking at women who've experienced these traumatic births and what are we doing to support them after. Is there a proper debrief about what went well, what didn't go well, what they should do next time, what they don't want to happen next time, and make a plan for the next birth so that their concerns are addressed? Because right now, something is not working. Medical professionals can stamp their feet, jump up and down and say, this is wrong, but women are still doing it. The tactics that we are using to try and make delivering babies safe and not traumatic are not really working. There's obviously other things at play here as well. You know, there's more distrust of the medical community in general. And then you've got the other side of the spectrum where natural births are portrayed as somehow empowering and spiritual and all this kind of stuff, which I don't particularly agree with. The one thing I do agree with is that everybody has the right to make their own decisions, but it should be an informed decision. You should know exactly what the risks and the benefits are of each type of delivery. And that includes the worst case scenario, because if you go to deliver a baby in hospital, you'll be told worst case scenario, you could die. Is the same being said when you're doing a home birth? Honestly, I don't know. I don't know the answer. I don't know if any of you guys out there know the answer. I don't think this should be about blame. This should be about learning. It should be about improving, and it should be about finding ways to make birthing safer and more compassionate, I think.
I have a bit of a hot take on home births, okay? And this is coming from someone who had an extremely traumatic birth. I'm not talking like, oh, emergency C-section. I'm talking I almost died 2 times. I was in the ICU for 3 weeks. My baby was in the NICU for 83 days. Neither of us would be alive if we had chosen to do a home birth. I just feel like, why do it? You can have whatever kind of birth you want at the hospital. You know, why not be there with medical? There's so many things that can go wrong. Okay, there's 2 stories now recently. One where the baby didn't survive, and now one where the mother didn't survive because they decided to do it at home. I have friends that I've met here that had extremely traumatic births, and you know, one of them, they barely made it to the hospital in time. Thank God that they did. But there's just so much that can go wrong. Like, I don't understand why you wouldn't just eliminate that risk. You can have a midwife, you can have a doula, you can have a natural birth, like at the hospital if you want. No epidural. Like, why not have the medical professionals there in case something goes wrong? You don't know if an umbilical cord's going to be wrapped. You don't know if there's the shoulder dystocia thing. Like, there's so many things that can go wrong that are unplanned. You can hemorrhage. Anyone can hemorrhage. And you have no idea who it's going to happen to or when. I don't ever want to make people feel like bad about their decisions or whatever, because we all do, you know, our best with what we have available. But I'm just curious, like, what benefits does it have over going to a hospital? The only people I can see it making sense for is like if you live really far away from a hospital.
Our baby girl passed away after our planned home birth because of a shoulder dystocia. My advice to anybody planning a home birth, especially if you are a first-time mom, is to please interview midwives with so many questions.
So first, my heart goes out to this mom. This is a terrible, terrible thing to hear. And for her being willing to post online and educate others about how to approach the situation is really powerful. So I just really appreciate that. I think everybody has a gut reaction to home birth. Should you do it or should you not? The American College of Obstetricians and Gynecologists actually says, okay, we acknowledge that the hospital is the safest place to deliver a baby, but also grants the right of people and mothers to have autonomy over their body and decide the setting that they want to deliver in. But if they're going to do it, it should be a medically informed choice. So here are some key statistics you should know if you're considering this for yourself. First, what are the benefits? Well, it is true that you will have fewer interventions performed on you and your baby if you do it at home compared to a hospital. That means fewer epidurals, fewer inductions or augmentation with Pitocin, fewer C-sections, fewer episiotomies. That is very true. Interestingly, mothers also have fewer severe perineal tears and fewer infectious complications. And what are the risks? Well, basically, there is a 2 times increased risk of death for infants who are low risk but delivered at home compared to a hospital. There's also a 3 times increased risk of neonatal seizures or neurologic dysfunction, which could have lifelong implications. So what does that mean? It basically means for every 1,000 babies who are born, there will be about 1 or maybe 2 infants who will die if they are delivered at home who otherwise would have survived if they were delivered in the hospital. So to be clear, we are talking about low-risk infants who are singletons, they are presenting in the right position, There was no history of C-section. If any of those things are not true, then the mother really has to deliver at the hospital. It is way too unsafe to do it at home. The final thing to note is that if you're a first-time mother, labor often doesn't go as planned, so even if you try to deliver at home, 24 to 37% of patients will end up transferring to the hospital at some point, so make sure that that plan is in place.
Nothing makes my stomach sink more than somebody talking about doing a home birth. Obstetrics is one of those things where you don't know what you don't know. There are things that make people low risk and there are things that make people high risk, but oftentimes all of that goes out the window. In high risk patients who have been counseled on all of the complications that may happen during their labor have beautiful deliveries, and I've seen the most low risk patients lose half of their blood volume during their delivery. When I say you don't know what you don't know is that you just never know what's going to happen. What I do know is that at a well-equipped hospital with well-trained doctors and staff, we can manage almost anything. We can save your life, we can save the baby's life, we can move to the operating room if we need to. We have everything we need in one spot. People are birthing at home. Time is not on your side if something happens, and you just don't have the resources that you have at the hospital. Some of the most devastating outcomes I've seen thus far in residency have been home births that were transferred to the hospital and were just a little bit too late. I think everyone deserves a beautiful birthing experience, and yeah, I think delivering at home as opposed to in a hospital sounds great, but is it worth the safety of you and or the baby? I know that a lot of people do a home birth or birth at a birthing center because of mistrust in the medical community. And as a Black female provider, although I've never experienced that mistrust, I can understand historically why people feel that way. But I just think without a doubt, people are 100% better served at the hospital.
Controversial opinion, you should never have a home birth. As an ER doctor, I've seen some pretty scary childbirths. But as a soon-to-be dad, it hurts to even think about possibly losing my daughter or my wife. Here are some emergencies you're not equipped to handle at home. Number 1, massive bleeding. If you've never had a fetal ultrasound and don't know where your placenta lies, sometimes the placenta and blood vessels can lie just above the cervix. So when it's close to delivery time, you can bleed a lot because it starts pouring out like a fountain, putting mom and baby at risk. And when blood losses start to approach 1.5 liters, mom will need additional blood, medications to help clotting, and emergency operation. Number 2, severe high blood pressure. In regular, non-pregnant adults, high blood pressure is not always an emergency, but in pregnancy, it could lead to vision loss, kidney and liver injury, clotting and bleeding problems, and even seizures, often requiring IV medications. And lastly, you won't know what's going on with baby during contractions, which means you won't know if there's cord compression or placenta issues, which can cause brain damage if not fixed quickly.
Okay, that was a lot to sit with. Let's slow down and actually break apart what we just had, because there's more agreement between these two groups than it looks on the surface. Almost every mother in these videos who had a rough outcome said some version of the same thing. She didn't fully understand going in what could actually go wrong. Not in a vague, there are risks way, in a specific, physical, step-by-step way. What does it actually look like when a baby's shoulder gets stuck on the way out? What does it feel like physically when contractions suddenly stop in the middle of labor? How fast can heavy bleeding turn from a lot of blood into a life-threatening emergency? Several of them said, almost word for word, that they only learned these details after living through them, not before. Nobody sat them down beforehand and walked them through the ugly version of what could happen. You also had a very common reason moms choose home birth in the first place, and it wasn't ignorance. It was a bad experience with an earlier hospital birth, feeling rushed into decisions, feeling unheard when they raised a concern, feeling like things were being done to their body instead of with them. That's not irrational, and it's not something to brush off. For a lot of these women, home birth wasn't just about rejecting medicine. It was about wanting to feel like a person again, in control of her own body during one of the most vulnerable moments of her life. And to be fair to home birth, most of the people who support it talk about real measurable benefits too. Fewer medical interventions, more control over the environment and the pace, less trauma, a calmer space to labor in. Those benefits aren't just feelings, they are backed by data. People having low-risk home births generally do have fewer C-sections, fewer epidurals, fewer several tears, and fewer infections compared to people delivering in hospitals, and that's a real trade-off, not a myth. Now here's what almost every doctor said, in their own words. Hospitals exist for the moments you can't predict, not the 95% or so of births that go completely fine on their own. The other slice that doesn't, a cord wrapped around the neck, a shoulder that won't come free, bleeding that starts fast and doesn't stop, a baby's heart rate dropping and nobody catching it in time because home monitoring, even done carefully with a handheld Doppler, just isn't as constant or as sensitive as continuous hospital monitoring. One doctor put it about as simply as it can be put. Someone can walk in as the lowest risk patient imaginable, great pregnancy, all the testing done, no red flags anywhere, and still have a sudden, serious complication nobody saw coming. And someone flagged as high risk on paper can have a completely smooth, uneventful delivery. The point the doctors kept making isn't that risk labels are useless, is that a low risk label is a probability, not a promise. It tells you what's likely, it doesn't tell you what's certain. The doctors also brought hard numbers into it, and it's worth sitting with them for a second instead of rushing past. For low-risk single babies who are in the right position for delivery, home birth carries roughly double the risk of infant unaliving compared to a hospital birth, and about triple the risk of serious newborn brain or nerve complications, the kind that can affect a child for life. In real terms, that works out to something like 1 or 2 extra infant unalivings per 1,000 births. Babies who most likely would have survived if hospital-level care had been available in that exact moment. That number isn't meant to scare anyone away from a choice. It's meant to be the same kind of blunt, honest number a surgeon gives you before an operation. So you're deciding with your eyes open instead of your fingers crossed. Here's the part that might genuinely surprise you. Almost nobody in this video, moms or doctors, said home birth should be banned outright. Even the doctors who sounded the most cautious said clearly that people have the right to choose where and how they give birth. And even the moms who lost their babies or nearly lost their own life said they weren't trying to scare every pregnant person away from home births completely. What they wanted was for the next person considering it to go in with the full picture, not the hopeful version. So the real disagreement in this conversation isn't actually about where you give birth, it's about how well someone understands the choice before they lock it in. Everyone, moms and doctors alike, even when they clearly land on different sides, kept circling back to the exact same idea. If you're going to do this, you need brutally honest information first. Not a general, there are some risks, but you're low risk, so it's probably fine. The actual worst case picture laid out in detail, what a true obstetric emergency looks like physically in real time. How fast you'd realistically need to get to a hospital if things stand, which hospital specifically, what the backup plan is if your midwife can't get to you fast enough. There's also a quieter, bigger issue sitting underneath almost every one of these stories: trust. A lot of people choosing home birth aren't choosing it because they've stopped believing in doctors or medicine as a whole. They're choosing it because a past experience with the medical system left them feeling dismissed, rushed, or unheard. And nobody ever sat down with them afterward to properly talk through what happened, why it happened, and what could be different next time. That missing piece, the lack of a real, honest debrief after a hard birth, quietly pushes people toward home birth without ever fixing the actual problem that sent them looking for something else in the first place. So maybe this isn't a home birth versus hospital birth story at all. Maybe it's a story about a maternity care system on both sides of that line that needs to get a lot more honest and a lot earlier with the people going through it, because the moms in this video didn't lack courage and they didn't lack love for their babies. What a lot of them lacked was the full, unfiltered picture before they made their choice. And that's something both sides of this argument could actually work together to fix.
My wife is 7 months pregnant, and whenever we tell somebody we're planning to have our baby at home, they think we're crazy. And honestly, I get it, because we've been conditioned to think that hospital births are the best option. Now, don't get me wrong, modern medicine has significantly reduced birth risk since the 1900s, but a lot more has changed since then too. For low-risk pregnancies, multiple studies show that planned home births with a trained midwife have similar and even slightly better safety outcomes than hospital births, and with fewer interventions. The system treats birth like an emergency. We're preparing for it like biology.
We don't treat it like an emergency, but we prepare for an emergency. Anyway, let's look at the research that he presented. So the first one is planned home births versus birth centers. So that's not hospital, so I'm just going to skip that. The next one, planned home compared with planned hospital. So let's read this. The mortality rate was lower in planned home births. Then it cuts off. Then here it says, in planned home births, especially multiparous women, show universally lower intervention rates. However, the benefit is substantially fewer, and it cuts off. I wonder what he cut off. Found it. This is where he cut off. In planned home births especially, multiparous women showed universally lower intervention rates. However, the benefit of substantially fewer interventions in the planned home group seems to be counterbalanced by the substantial increased mortality if intervention occurs. He also cut the bottom of this off. In risk groups, a higher perinatal mortality rate was observed in planned home births. So the study actually took place in the Netherlands. They defined intervention for the study as operative vaginal delivery, so vacuum or forceps, and a C-section. So the conclusion makes sense, right? Home births are going to have less C-section and vacuums compared to the hospital. However, higher perinatal mortality. But of course, he cropped that out. Now, I wish him and his wife a safe home birth, but please stop giving only half the information.
People who are not, absolutely not, candidates for home birth include fetal malpresentation, meaning anything other than head first, multiple gestation, anything more than one fetus in that uterus, or a prior cesarean delivery. Absolute contraindications. So, to sum things up, you need to know the credentials of anyone who is planning on delivering you at home. See receipts. Don't just take their word for it. Look to see if they have had any complaints lodged against them or any actions taken against them. You can do that by going to your state licensing board for midwives. That can be done. Number 3, ask about the stats that they have on how quickly they can get you to the hospital in the event of an emergency. And finally, if anyone is recommending that you or saying that you are a candidate and you don't meet the criteria that I just mentioned, huge red flag.
If you made it this far, I appreciate you watching. Let me know what you think in the comments. If you enjoyed the video, don't forget to leave a like and subscribe for more content like this. Creators' handles are in the description box below. I'll see you in the next one. Bye.